Today, the topic of discussion is M.I.A Syndrome, M.I.A Syndrome, malnutrition, inflammation, and atherosclerosis. In the dialysis unit, many a time you can see a patient who says the patient's weight before dialysis was around 70 kg. As the patient started on dialysis, over the period of 6 months, 1 year, the weight came to 60 kg. And the patient is having recurrent admission for one or other reason. Eventually, the patient quality of life decreases, the mortality and morbidity increases. This is because of the three interlinked concepts. One is chronic malnutrition. First, why in a dialysis patient malnutrition can occur? There are various reasons. The more prominent one to be told here are uremic milieu. Patient might not be having regular appetite. The second one, gastritis. The third one, chronic metabolic acidosis leading to muscle breakdown. The anabolism won't be there, rather there will be catabolism. Multiple drugs, again loss of appetite. The most important being, as it is a era of social media, many a times patients get misinformation related to the protein intake. They reduce the protein to a very low level, especially the belt where I am practicing. The patient usually restrict the protein to very low level over a period of time in an idea to bring the creatinine down. But what it lead to is low anabolic protein, leading to chronic malnutrition. Chronic malnutrition, how to detect it? Serum albumin level, patient's clinical examination, and the quality of life. Many other parameters, vitamins and minerals can also be checked, but overall you can check through the patient weight and the quality of life. This is one thing, malnutrition. The second, M.I.A, and the second one is inflammation. The CKD dialysis patient are inherently prone to chronic inflammation. CKD itself is a chronic inflammatory state. Uremia, acidosis, dyselectrolemia, infection. On top of it, a dialysis patient having the catheter, recurrent infection, recurrent exposure to extracorporeal circuit, extracorporeal blood being returned back. Catheter play important role in inducing inflammation. Major role. Even the patient is on AV fistula, a chronic inflammatory state can be there because of the recurrent extracorporeal circuit exposure. This itself puts the patient prone to inflammation, and because of the malnutrition, the malnutrition and inflammation cascade worsens fast. Chronic inflammation causing malnutrition, malnutrition causing chronic inflammation. The third, the devil comes now, atherosclerosis. Most important cause of mortality in the dialysis unit. If you are practicing for more than 2 to 3 years, you might see a malnourished patient eventually succumb to the disease because of any cause, but it might have started with M.I.A syndrome. Atherosclerosis, vessel calcification, endothelial dysfunction, high inflammatory marker, cardiovascular load, all leading to accelerated atherosclerosis, leading to CAD, coronary artery disease. Any kind of vascular accident is very common, leading to mortality. Why it increases? Again, malnutrition interlinked to inflammation, interlinked to atherosclerosis. Atherosclerosis, again, this is a triangle where one accelerates or fuels the other. This is called M.I.A syndrome. How to diagnose? The inflammatory markers might be on the higher side. Interleukin levels, interleukin 6, ferritin, CRP, any inflammatory marker can be on the higher side. Procalcitonin can be high, indicating a subtle sepsis. The typical sepsis parameter in a normal patient might not be present in a dialysis patient. Fever might occur during only dialysis. Related to atherosclerosis, the markers, vessel calcification can be high, coronary artery calcification can be high. This is M.I.A syndrome. How to diagnose? There is no particular test. You do this, you will diagnose. It is the clinical history plus the laboratory parameters and the patient's quality of life. As I discussed the laboratory parameters, patient might be anemic, patient might be losing the body weight, interleukin, ferritin, CRP, procalcitonin levels can be on the higher side. The markers of atherosclerosis can be on the higher side. Dyslipidemia can be present. One of the important complications is mortality. So now coming to the treatment. Earlier the better. Treat all three of them. Malnutrition first, increase the nutrition. Make sure patient appetite is getting better, and counsel the patient related to protein intake and what are the advantages, so that they might not be stick to the point high protein equal to high creatinine. That we discuss separately, but that won't work in dialysis. High protein is required. That is why every guideline says high protein diet in a dialysis patient. Nutrition focused, then inflammation. To reduce the inflammation, if the patient is on catheter, try to switch to AV fistula. Look out the inflammatory, what are the things which can cause the inflammation. Any chronic sepsis, try to treat it. Permacath infection, if it is there, try to treat it. Any chronic inflammatory markers can be reduced with the help of statin can be used. That itself is for the atherosclerosis only. This chronic inflammatory thing and atherosclerosis can be combined together and managed. A low dose of cardiovascular protective aspirin might be required. Beta blockers, as the risk is high, bring on the preventive measures. Good quality dialysis, clearance, good clearance, high flux, high clearance dialyzer might be required if the patient is in clearance is poor. Target high parathyroid hormone, intact parathyroid hormone level to be in the recommended range, 2 to 9 times the normal. Calcium, phosphorus have to be focused. Hyperphosphatemia is one of the cause of accelerated atherosclerosis, that have to be focused. So this is the treatment strategy. Treatment strategy of M.I.A syndrome is focusing all three separately. The purpose of this video is to say the resident there is some condition called M.I.A syndrome, which is the leading cause of mortality. Even though if you might not find in the textbook as prominent as MI, soon or later this is going to be the one which will replace the word one of the most common cause of mortality in India in dialysis patient is M.I.A syndrome. Sooner or later you will get in the textbook, and this is what you should know. You might get this question in the paper 4 and also for your clinical practice. I hope you got idea about M.I.A syndrome. Any doubt, comment below. Next video we will see.